Nursing is a very diverse career, and it gives you the opportunity to stay in clinical practice, which is incredibly rewarding, but it has great diversity, so you can go off and do research and you can become an academic, or you can go into education and be teaching, and you can teach in practice or you can teach in the university. But all of it's about improving the patient experience, and therefore it's very enriching, very rewarding, and I thoroughly recommend it as a career.
Nursing, it has given me the tools, the knowledge and the experience to go out there to pursue the work which I wanted to do.
The placements are really good. They varied them to acute placements, medical placements, surgical placements, very broad.
I'd say always go and get a little bit of experience first of all to make sure it's the subject that you want to pursue, because obviously you have to have the compassion element there, and it's something that you need to want to do rather than just studying it for a course. Brighton University will give you those tools to do that, but you have to be very proactive in your learning there. You know, you can't expect to be spoon-fed, but it's a good place and there's lots of support there if you need it.
I'm pretty sure that the contacts that I've made on placement will help me to find a job almost immediately after leaving, because we've got placement over the whole 3 years in all of the different settings that I've been in. I've made friends with someone that will help my career progression.
The best advice I give the students who study nursing is get to know the people that you're actually on the course with, maintain those relationships because you'll need the support throughout the course. So yeah, and enjoy it.
All of the different sort of professions that you come across within nursing, you have to work with each other and of course with the patients as well. So I think it's taught me a lot about relationship building.
So the best thing about studying children's nursing was the support that we got from all our mentors on placement and our practice. So
I think the variety that the course gives you, you're constantly in placement and there's no block placement, so it's you're in uni and placement at the same time, which I think gives you a lot of continuity with your learning. It's not like you're just dipping in and out of education and practice, so it's good.
It's given me a much firmer idea of where I want to take my career and the sector that I want to go into. It's opened my eyes to the charity sector, independent sector, as well as the NHS. Be open to everything that the university throws at you, because it throws a lot of stuff at you, and it's brilliant stuff. If you can keep rolling with it, then you will learn a lot about yourself and a lot about the world around you.
Here at our school, we can offer all pre-qualifying students the opportunity to undertake a placement abroad. I'd like to introduce you to Paula Deemer, our senior lecturer who's responsible for managing these placements. So Paula, can you tell me what your key role is?
My role is to help to support the students who have decided to undertake the exchanges, to liaise with our partners in the other countries and to help the students get the most out of the experience.
I think that it made me more open-minded about the different healthcare systems that are available throughout Europe. Especially in Denmark, obviously, and I think ultimately that has made me more open-minded about potentially finding a job outside of England, and it's not all about the UK even though you're studying here.
And where do we send our students?
Yeah, we've got more than 26 partners across Europe, so there's quite a varied experience for them to be had there. And we've also got partnerships in Australia and also America.
They provided us with accommodation and also they found a placement for us. So like in regards to some other universities, they don't always make those arrangements, so you're left to your own devices. So I think there was a lot of support in regards to that.
And when you see the students come back to the UK, what differences do you see?
Well, obviously enthusiasm and excitement about what they've experienced, and then we try to help them to unpick that and then they start to see things like how internationalisation of health is, and also their place as a nurse internationally, rather than looking inward just at their own country.
It made me grow both personally and like professionally in regards to like you're out there for 3 months, and there's also different like barriers that you will come across, and I think that ultimately it made you more versatile to the experiences that you had, and also professionally obviously seeing the differences in healthcare was fantastic really.